All right, so welcome everyone to CRAN's webinar on debunking nutrition misinformation for colorectal cancer patients. And thank you for joining us this evening or this afternoon, depending on where you're coming from. So my name is Cassandra McCauley, and I'm CRAN's Senior Manager of Programs and Education. We're really pleased to be bringing this webinar to you tonight. I receive a lot of questions about what and what not to eat from our colorectal cancer patients and caregivers, and understandably so. The great thing about nutrition is that it's something that you can really take control over. At a time in your life when there is a lot that is out of your hands, being able to support your body through nutrition certainly can help to provide a sense of control, and your actions can actually have an impact on your quality of life. But there is just so much misinformation out there that it can be difficult to make informed and evidence-based decisions. So tonight, we're going to address some of the myths and the misinformation out there and speak about nutrition recommendations specific to colorectal cancer. After a short presentation, we will have an open Q&A session where you will have the opportunity to ask all of your burning questions about nutrition directly to CRAN's National Registered Dietitian. So just a few housekeeping notes before we begin. I will ask that you leave your mic muted throughout the presentation. And then after the presentation is complete, we welcome you to come off of mute and engage in the conversation. You may ask your questions directly to Felicia, or you can send them to me in the chat and I can ask questions anonymously as well. So with that, I'm very pleased to introduce CRAN's National Registered Dietitian, Felicia Newell. Felicia has a bachelor's and a master's in nutritional science and has worked in areas such as research, education, healthcare, and private practice for many years. Felicia oversees the expansion of CRAN's My Foods for Life program, in addition to the development of a primary and secondary cancer prevention program. She is passionate about helping cancer patients meet their nutrition needs and manage symptoms in a realistic and manageable way, and is honored to support the nutritional needs of CRAN patients. We are so very privileged to have her as a part of our team. And just go ahead and take it away there, Felicia. Thank you.
Thank you. Thank you so much. And thank you so much, everybody, for being here and for sharing your time with us. So happy to be here and have this discussion. Misinformation is something I talk about a lot in my practice, with the general population, but particularly with colorectal cancer patients as well, and even just cancer patients in general. There's so much information out there, and the age of social media and just media in general, there's so many great things about the wealth of information out there, but there's a downside as well. We know there's a lot of misinformation out there. So we really envision this to be as much of a Q&A as possible, but I also wanted to put together at least some education, some content, just to get us talking and thinking. And then we're going to leave quite a bit of room for discussion at the end. So hopefully if you have any questions, we can Oh, so sorry. I think somebody's not on mute. So I thought you were talking to me, but I don't think you're talking to me, whoever just said that. So I will get started. Again, we're going to talk about debunking nutrition misinformation for colorectal cancer patients, and just a little bit of outline of what we're going to discuss. So I'm hoping to get through this part in about 15 to 20 minutes, and then we'll leave lots of room for discussion. So we'll talk about the rise in and dangers of misinformation, a couple common myths. I mean, I know there's so many out there. I just picked a few of them that come up a lot in my practice. And then we'll talk about how to identify information, how to identify a trusted source, and then again, leave lots of room for Q&A and discussion. So as I mentioned, there is a rising increase in misinformation on social media from unqualified experts that kind of present themselves as an authority and an expert, particularly around health and nutrition. We don't necessarily see that in a lot of other areas. I have a quote about that later in the presentation. But these messages can be harmful. I mean, some are harmless, depending on what the information is, what the message is. Some, of course, can be harmless, but some can be harmful as they contribute to unnecessary fear and restrictions of foods, and in rare cases, consumption of dangerous eating patterns. There's lots of different examples out there. I just put the carnivore extremists as one example.
Felicia, sorry to interrupt. Your audio is just cutting in and out a little bit on my end, and it looks from the nods that I'm getting like others are experiencing that as well.
So remember what I said at the beginning, that my AirPods are hit or miss? So that's likely what's happening here. So I'm going to disconnect from my AirPods. I apologize for that, everybody. I have children, and it's 8 p.m. here where I am. So I was trying to shut out some of the background noise, but I think just for the interest of hopefully that won't happen again, I'm going to take out my AirPods, and then, so I apologize.
No problem.
Can you hear me now?
Yes.
Okay, I just had to wait for my computer speakers to connect. Okay, so hopefully that shouldn't happen again. Obviously that's just one example, the carnivore diet, saying that it's mostly meat focused, little bit of vegetables, little bit of fruit, but some of the extremists will even say that there's, research out there saying that vegetables are harmful to health, right? Like there's a lot of different stuff out there. And if we listen to all of the quote unquote experts, we would literally be eating air every day, which is of course dangerous. So again, some information can be harmless, but it can be harmful, especially when it contributes to unhealthy relationships with food, which we know is already an issue. These posts, articles, videos, they always, or usually I should say, sound compelling. They get a lot of engagement, views, likes, etc., because it has been shown that false information spreads faster and more easily than the truth. For example, a study published in Science magazine showed that false information was about 70% more likely to be retweeted on Twitter than the truth, and had reached 1,500 people about 6 times faster than true factual information. All right, now I'm just trying to get my pointer back because when I switched from my AirPods, exit full screen, will that work? Okay, but I don't want to do that. Sorry about that. Once I get this back, it should be fine. I just lost my pointer. Okay, there we go. So why does false information spread like wildfire? There's lots of different reasons. Researchers found, and I agree in practice, just seeing the information myself and speaking to clients and other people, that this kind of fake information or untrue information tends to provoke more intense types of feelings, such as surprise or shock or fear. It's more often alarming and uses fear mongering to touch people's pain points, similar to marketing tactics, like they use language and words that kind of hit people's pain points and what they're concerned or nervous about. And this means that people are more likely to engage with it, comment, react. Again, and a lot of the time it sounds really compelling. The person really either believes what they're saying, or they're just like, there's also disinformation where people knowingly share misinformation. But sometimes people just spread misinformation because they truly believe it themselves. And obviously, sometimes, again, it's disinformation, and it can make it more tempting for creators and professionals to spread misinformation because they know their reactions and the engagements that it gets. Dr. Oz is probably one of the examples of the original misinformation. He started off probably with good intentions, giving somewhat good information. And then the more, you start to see what type of information gets more engagement, and then you go down that path. Additionally, algorithms of platforms such as TikTok and Twitter tend to amplify extreme views, likely because it does get more engagement. So this is why it's so important that we learn to think critically about the information that we consume. And I really, truly believe this is improving. We're talking about misinformation more. We have more professionals out there that are speaking out against misinformation. And it's a shame because usually the actual experts in the field
have spent years and years and years becoming an expert and, going to school and working in the field. And we don't have marketing training. We don't have, a lot of business training versus, some of these other wellness influencers, or, they have large followings and they have done a lot of training in marketing and business and things like that. So, it's hard to find the extra time when you're working 40 hours a week, or sometimes more when you're doing other activities, to share credible information on social media. But I feel like it's improving, and we're getting a lot more. I'll show you an example later in the presentation of really good quality information coming from health and nutrition and medical professionals. So I'm just going to again talk about a few of the common myths that I hear from patients and just people in general. So probably the biggest one is that sugar feeds cancer and promotes the growth of cancer. And as a result, many people with cancer will think that they have to remove sugar completely from their diet as an effort to slow or stop cancer growth. And the notion that sugar is bad for individuals with cancer can cause significant distress and prompt dramatic and unnecessary dietary changes. And again, just that unhealthy relationship with food. But sugar there are various forms of sugar, sucrose, fructose, but really when it's broken down into its smallest component that's utilized by the body, it's glucose. And that's found in many foods such as complex carbohydrates, simple carbohydrates, fruits, vegetables, dairy foods. So carbohydrates really in general are going to break down into the simplest form, which is glucose. And glucose feeds all cells. All forms of carbohydrates, again, break down into glucose, which is then broken down into acetyl-CoA, which is what feeds every cell in our body. When starved of glucose in the diet, the body will produce glucose from other sources, such as fats and proteins, via gluconeogenesis, because it needs it. It needs that glucose. And research has shown that giving more sugar to cancer has not been proven to cause it to grow faster. And there's been no human studies that have shown that reducing sugar intake prevents or treats cancer. And no studies have shown that eating too much sugar causes cancer. In other words, there's no direct link between sugar and cancer. And we do know that not consuming enough carbohydrates or total calories can lead to the breakdown of protein stores in our body, which can contribute to muscle loss and possibly malnutrition, which we know is something that we want to prevent with cancer patients, particularly if you're undergoing treatment. Another example, so a 2019 study found no link between soft drink intake, which again are higher sugar, so sugar sweetened beverages, and colorectal cancer. And a 2012 study by researchers at the National Cancer Institute found no association between dietary sugars and an increase of colorectal cancer or any other major cancer. So it's not necessary to completely avoid sugar. Yes, it is, over the years, our food industry has added a lot of sugar, and there's a lot more added sugars to our diet. And these foods, they do tend to taste really great, right? Like they're, what's the word I'm looking for? I want to say pleasurable, but that's not the word I was looking for. But they, I can't think of it. It's 8 o'clock and it's really warm, but you know what I mean? It's, we enjoy it and we have abundant access to it. So we tend to overconsume, and that's where the issue lies. And again, as I'll probably say many times throughout the presentation, it is the overall dietary pattern and lifestyle that matters the most, not one specific food or food group. And it's important to reduce our added sugar intake and ultra refined foods to roughly less than 20% of our overall intake, and focus on consuming nutrient dense and higher fiber carbohydrates, fruits, vegetables, legumes, things like that, that will help reduce cancer risk and help manage chronic disease. A growing body of research shows that eating too much sugar may affect body weight, which may contribute to obesity. So the World Cancer Research Fund and the American Institute for Cancer Research state that being overweight or obese throughout adulthood is associated with an increased risk of 12 different cancers. Researchers are still investigating the link between obesity and cancer. There are many factors that could play a role in how obesity impacts cancer risk. risks, such as alterations in hormones, inflammation in the body, just various habits and lifestyle choices, or how weight bias factors into medical care. Somebody in a larger body could present with the same symptoms as somebody with a smaller body, but they might not get offered the same level as care. They'll just be told to lose weight. So sometimes that will impact their care, right? So there's so many factors that impact as to why there might be this link. It's also important to note that being in a larger body doesn't automatically mean increased risk. Vice versa, being in a smaller body. There could be somebody in both scenarios where the larger body person is active, they're, eating fruits and vegetables or eating fiber, right? So we can't just judge based on body size. And there could be somebody in a smaller body who is, eats zero fruits and vegetables, is sedentary. So that's really important to note too, that there is that weight bias that we sometimes carry. So we can't just judge based on body size, but there is a link, and it is being explored in the research. So another myth that's common that I've heard over the years is that an acidic environment in the body promotes cancer. The alkaline diet proponents claim that certain foods promote higher acidity or higher pH levels in the body, which leads to negative health consequences such as cancer, but also others such as arthritis, inflammation, weight gain, among other various claims. The diet is supposedly be able to protect you against cancer because it reduces the amount of acid your body produces. The version promoted by the Acid Alkaline Association is intended to balance, quote unquote, pH by consuming 80% alkaline foods and 20% acid forming foods. Some versions are a lot more restrictive, so they tell you to actually avoid those types of foods. So the alkaline foods in a nutshell are vegetables, fruits, and legumes, and your acid forming foods would be beef, poultry, dairy foods, coffee, sugar, and alcohol. In truth, studies finding that cancer cells thrive in an acidic environment are typically done in a laboratory setting, such as in a petri dish. We are not cells in a petri dish, where our body is much more complex than that. And your body is very good at maintaining its pH levels without any influence from the diet, except urine. Your urine pH can be affected, which is, what proponents will tell you to test your urine. But your urine pH does not reflect the pH of your body. It's very difficult to alter the cell environment, create a less environment in our bodies, because we're very well regulated tightly between 7.35 and 7.45. And if it's too acidic or alkaline, that could be a life-threatening or an indication of an underlying condition or health problem. So our body very good at tightly regulating our pH levels. And although it's the case that cancer cells can't live in a very alkaline environment, neither can the cells in our body. So there is no evidence to prove that diet can manipulate whole body pH or that it has an impact on cancer. Another big one is artificial sweeteners. I've been talking about artificial sweeteners for years and years, and every few months another article, alarming headline surfaces and will cause mass fear and panic, mainly because people are human and many people like to consume certain foods such as diet soda as a treat, a few a week in a healthy diet, right? Really what matters most is what you're doing 90% of the time. Or there are some people that just find it difficult to change their habits, right? So again, that's where the stress and alarm comes from. One study came about that found a possibility that high doses of aspartame might cause cancer in rats. And another study in 2016 reported a higher incidence of blood cell tumors in male mice that were fed really high doses of sucralose. And more recently, I'm sure many of you have seen, there have been headlines on aspartame being classified as a possible carcinogen by WHO, World Health Organization, sucralose damaging DNA. So again, those are just in the past 3 to 6 months. I think, okay, no, not yet. I have 2 videos coming up, so I just wanted to preface them, but I'll just read the slide first. So the truth is that the overall body, the largest body of highest quality evidence, which we'll talk a little bit about later in the presentation, does not support that artificial sweeteners cause cancer. They are heavily studied. They have been for decades and decades. Health Canada has a position statement on them. And of course, there's ongoing research on the potential link between artificial sweeteners and cancer, but the current, again, largest body of evidence does not support the idea. Epidemiological studies, also referred to observational studies, where the investigator is not acting upon the study participants, but instead observing natural relationships between factors and outcomes, have examined possible associations between intakes of artificial sweeteners and risks of several cancers in people. However, studies of this type cannot establish a cause and effect relationship because there are other factors other than artificial sweetener use that may potentially explain the observed associations in those studies. Just one example, you can plot you can do a study on the most random things and find associations, right? I read this article, it was by scientists, and they did an actual study to show seemingly random things that were associated or correlated with other seemingly random things. There was lots of different examples that they gave, but the one that always I remember is that having an outie belly button was associated with watching Nicolas Cage movies or liking Nicolas Cage movies. And it's just so completely random, right? And there was like a straight line up, a positive association, but they obviously have nothing to do with another, right? So those types of research studies are important. But we can't always just look to those studies. We have to look at the larger body of evidence.
New headline says,
sorry. So the videos are next, and I just wanted to preface it first. So I usually show Dr. Itz's videos in and others of examples of health professionals that share really high quality information. But Dr. Itz is one of my favorite. He's on all platforms, Facebook, Instagram, TikTok, and his videos are short, they're succinct. He uses high quality evidence to back his statements. So I just like to show his videos just because he's very good at summarizing the data on certain points. And so if you guys can't hear, let me know, but I did share the sound, so it should be fine. So we'll watch those 2 videos and then we'll continue on.
new headline says aspartame possibly causes cancer. I've been bombarded with DMs about this, so time for school. Now, as always, people are repeating what they see and hear online because, well, many people can't critically think for themselves. So let's discuss what this actually means. So the committee that met was the International Agency for Research on Cancer, or IARC, which is part of the WHO. They class aspartame as a possible carcinogen. But what does that actually mean? Well, their own definition of the criteria is, this category is used for agents, mixtures and exposure circumstances which there is limited evidence of cancer in humans and less than sufficient evidence of cancer in animals. And it can also be used when there is inadequate evidence of cancer in humans but sufficient evidence of cancer in animals. So what this means is it's not been shown to cause cancer in humans, but when you give rats 200 times the dose directly into their eyeball, then yes, maybe it can cause cancer. Guys, let's be serious now for a second. They do not take into account how much of a product a person can safely consume. So once again, the dose makes the poison. And do you know what else the IARC have previously put into the possibly causing cancer category? Pickled vegetables and using your mobile phone. So the moment any one of you tries to fearmonger aspartame by calling it cancer causing, just know that you're outright hypocrites because you're typing this out on social media on your mobile phone. Aspartame is one of the most heavily researched food additives to ever exist, and the European Food Safety Authority has deemed it safe. And JECFA, which actually takes into account dosages, has stated that a small adult would need up to 36 cans of Diet Coke every day to be at risk. So stop freaking out over headlines. Class dismissed.
So that was probably one of his only videos where I found him a little bit more passive aggressive than usual, but I think it was just because there was so many people kind of jumping on top of the headline and using it to say like, oh yes, we knew that caused cancer. And it was just, there was a lot. I'm sure some of you might have seen it if you're on social media. And again, like we really need to, in order to make informed decisions, we need to have the best quality information. So that's why I really like his videos. Again, not all of them are as like, there was a hint of passive aggression in there. But we'll watch the next one and then we'll continue on.
Breaking new headline says that the artificial sweetener sucralose damages your DNA. I was sent this probably 300 times, so let's get into it. Time school. So here's a study looking at the toxicological properties of sucralose 6-acetate and sucralose, which is a manufacturing impurity and metabolite of sucralose. Now, it's a very technical paper, so let me summarize things for you. They saw that sucralose 6-acetate increased the expression of genes associated with inflammation and oxidative stress, as well as the MT1G gene, which is associated with liver cancer. Sounds scary, right? Well, let's look a little deeper. They ran 8 different in vitro experiments, and if you're not aware, in vitro means you test cells in a petri dish. So if you're a bunch of cells in a petri dish, put your hands up. Secondly, the TK6 cells were exposed to concentrations of 2 to 4,000 micrograms of sucralose and 6-acetate, and the lowest concentration of sucralose, which resulted in a 2-fold increase in gamma H2AX, which is a marker of DNA damage, was 994 micrograms per mil. Now, they do provide reference dosages that you'd find in sucralose drinks, but what they didn't consider was most of the sucralose you consume is excreted in the feces. So what you drink is not what you absorb. So how much is in your blood after a sucralose drink? Well, this study made adults consume up to 250 milligrams of sucralose, which is the equivalent of 4 diet sodas. They found blood concentrations peaked at 2 to 400 nanograms per mil. And do you know how big a nanogram is? 1,000 times smaller than a microgram. So if 4 diet drinks reaches 2 to 400 nanograms, you need to drink a minimum of 8,000 diet drinks to reach the concentrations they used in the study. The water would kill you long before sucralose did anything. Sucralose is fine. Class dismissed.
So that's just one example, or a couple examples. Again, I just like how he summarizes the research in digestible terms. A lot of the time, the layperson, the average person, I mean, I took research methods courses in my undergrad and in my master's degree. I worked at research center for, or sort of various research centers for, 8+ years. And it took me a long time, like, at the very beginning, even when I was doing the courses, a lot of it would go over my head, right? It really does take time to learn how to digest research studies and information out there. And a lot of these wellness influencers or documentaries or articles will kind of cherry pick evidence. And if you know what confirmation bias is you can literally search for any topic out there, and that it supports your theory and find an article on it or a research study, but is it the best and the highest quality information or the largest body of evidence? So just some tips on how to identify misinformation. We're seeing for the past 10, 15 years, there's been various buzzwords and marketing terms that have been used in the wellness industry that really have no true meaning. And no sound science to back them up. So such as, clean foods. What does clean foods mean? Does it mean that other foods are dirty? Chemicals, everything is chemicals. We're all made of chemicals, right? All natural, toxic, inflammatory, detox, cleanse. A lot of people will use these buzzwords again to kind of they promote or provoke these kind of, feelings, especially when you're talking about certain foods. A lot of the time they either don't use any evidence to back their claims, they just make these very bold statements or claims, or they use weak evidence, such as study done on rats, a small study posted 15 years ago, or one observational study. Promises quick fixes, such as heal your gut, fix your hormones, reverse disease, or really not necessarily quick fixes, but again, these very bold claims without anything to back it up. They blame a single food or ingredient or habit for chronic disease, such as, sugar or whatever it might be, which we know it's actually complex and multifaceted, with no single food or habit to blame for various diseases. They push you to distrust conventional medicine and practices, yet they push and often sell supplements which are unregulated, and they use appeal to nature fallacy. So natural doesn't always equal better. Man-made doesn't always equal bad. For example, arsenic is natural, and there's lots of other examples. So it's really important to look at new information critically and, use our critical thinking caps and skills, ask questions. Where's it coming from? Are they trying to sell you something? Do they have the credentials in that specific area of expertise? For example, a doctor or a psychiatrist should not really be seen as an authority on nutrition unless they have really significant extra training to back it up. For example, Dr. Ids has a master's in nutrition research. And, because obviously doctors and psychiatrists, they're extremely intelligent and they have a wealth of knowledge, but they don't get a lot of training in nutrition. And, when in doubt, look for information from a trusted organization such as American Institute of Cancer Research, World Cancer Research Fund, National Cancer Institute, Canadian Cancer Society, CRAN, Health Canada. A lot of the times, if you're looking for certain information, you can just go on these websites, search for it, and they have a lot of articles debunking misinformation as well. And they have dozens, hundreds, if not more, professionals and researchers behind them who understand how to interpret and digest, again, the largest body of evidence. When you're, digesting or verifying information, especially if it's a really alarming and bold claim, that kind of evokes that fear or worry, make sure you're hearing it from the same thing from multiple trusted experts and organizations. Most evidence-based professionals such as dietitians, nurses, doctors, etc., have the education to digest and interpret research. However, even these professionals can make mistakes. A small percentage can even get sucked into misinformation. And so it's important to hear it from multiple different sources, and ideally, large organizations with lots of researchers and professionals behind it. Again, it can take years to fully understand the ins and outs of research. That's why it's so important to have, your healthcare providers, your physician, work with your dietitian. I'm available as a resource for support. Even if you have a dietitian, it's, having two is better than having one or none. So just reach out to, use those health professionals and always, and try to educate yourself on the hierarchy of evidence or on research itself. But again, that can take time, and give yourself grace when it comes to that. Because I remember, again, first learning, like I took, multiple semesters and courses at undergrad and graduate level of research. And then it took me practice, working at various research centers and years of practice to fully comprehend how to interpret evidence. And I'm still human and make mistakes, of course. So this is the hierarchy of evidence. There's certain types of evidence, research studies that are deemed higher quality than others. And if someone is using research to back their claim, again, making a really bold claim, X causes cancer, you want to see more studies from the top of the hierarchy, systematic reviews, even like randomized controlled trials, but it has to be multiple and larger studies. And systematic reviews usually review all of, or at least all of the higher quality evidence out there. And there's also various stages to evidence. Early in the hypothesis gathering, information gathering, they will use in vitro or mice studies. Sorry for the typo there. But when we use evidence to inform recommendations, we really want to look at the strong, repeatable data that we're seeing over time, and that's what we want to use, not just these one random studies that might be done in mice or in petri dishes, which is what in vitro means. I just put a quote here. Probably the biggest problem is that everyone feels that they can be an expert on nutrition. If there was a debate about the optimal rocket fuel to get to Mars and back, you wouldn't have bloggers, book authors, and athletes all talking about it, and with people listening to them as though they had all equal weight of expertise. But again, there's so much information overload out there. There's books and blogs and articles, and it's hard. It's misinformation overload, or just information overload in general. There's something called the Dunning-Kruger effect. This is not my graph, and there's lots of different versions about it. So this isn't my term, but it's just basically when somebody has limited knowledge about a certain topic, that's when they tend to have the most confidence. They say stuff with such rigor and such, can't think of the word right now, but they have a lot of confidence about it, versus when you actually are a professional and you're an expert, or at least learning, you're going through your various stages of education and years of practice, you actually realize how much there is to know. And then eventually you get to the point where you feel much better about it. You feel like, okay, I'm an expert, but you never, you always are open to learning and accepting new information. Still not as confident as what, these people right here at the beginning, when they just have such a confidence about a subject they actually don't have a lot of training about. And
Felicia, sorry to interrupt. I just wanted to let you know we've only got about 20 minutes left.
How are you?
I'm done. Sorry.
Okay.
No, I'm just gonna close. I was just gonna close.
And this is the last one. So I just wanted to say, again, there's many factors, controllable and not controllable, that can increase or decrease cancer risk. And just, again, after working with so many people, I know it's a very stressful time, and you want to do whatever you can to take control, and you absolutely can, but it's important to focus on the factors that you can change and limit stress about the factors that you cannot change. And yeah, we started a few minutes late, so I apologize for that. I wanted to get through it quickly, but sometimes I go off on tangents. But if anybody would like a copy of the presentation, we can share a link that you can view the presentation, or a PDF version. And there's some resources on there as well. But and here's my information. I work one-on-one with CRAN members and caregivers. If you have any further, if you want me to do a one-on-one nutrition assessment, or if you just have any quick questions that we're not able to address today, you can always reach out to me via email. Yeah, so we will go through questions and have a discussion now.
Wonderful. Thank you so much, Felicia. That was awesome. So at this point, we'll kind of open the floor for any questions, and just for the benefit of people that were joining us a little later, feel welcome to just go ahead and voice your questions or raise your hand, or if you're more comfortable, you can certainly put them in the chat and I can ask questions anonymously.
I'll throw my hand up. Felicia, it's Mike here. You've already helped me. You sent me a whole bunch of information, which I really appreciate. And I still need to go through it a lot. I just had my last round of chemo, and I'm now just trying to figure out what I'm going to do next. And certainly your help's key. Now, I just quick question about supplements. Do you have any opinion on like natural supplements or things like that?
Absolutely. And obviously it's a broad topic, right? So it really, when it comes to supplements, certain ones there may be a benefit. What I'll normally do, as you know, I'll do nutrition and assessment, and I always recommend food first if possible. If you can get nutrients through food, then that is the ultimate goal. But if there's lots of reasons as to why you might not be, whether it be food preferences or food access, or going through treatment and having, symptoms, nausea, whatever it is, right? So if you can't get it through food, that's when we recommend through supplements. So sometimes there is kind of specific deficiencies that I will kind of look for, and whether it's vitamin D or omega-3, especially certain things that have been shown to have a positive association with cancer patients or with cancer treatment. Obviously, it's always really important, like, to work with your dietitian and your physician and even pharmacist, because there are certain drug nutrient interactions or interactions with certain supplements. So you want to take them at different times than medications. So it's always important to have that conversation, that communication with your whole healthcare team. But in general, like, does every person need a supplement, or are there certain supplements that are kind of recommended across the board? Not really, no. It's kind of a myth that other than taking calcium supplements or just having in general adequate calcium intake preventing the risk of colorectal cancer, there is adequate evidence to support that. But there is no one blanket statement like every person or every cancer patient should take a multivitamin or vitamin D or anything like that. And then when it comes to like other supplements such as herbal remedies and things like that, again, it's really important to have that conversation with your healthcare team, because there are some that are safe and you can incorporate. But there also can be adverse reactions when it comes to various, like I said, medications or treatments or things like that. So does that kind of answer, because obviously it's a broad question, but does that kind of answer it?
Yeah, no, yeah, for sure it does. Thank you.
You're welcome.
Rob, go ahead.
So Felicia, this one deals with IV. and getting IV supplements. So I go to a naturopath, and every week or 2 weeks, I get what they call a banana bag, which
Mhm.
is a multivitamin supplement. And other than listening to the naturopaths, I don't really know whether it's good for me or not. So that was one. And the other thing is plant-based, being solely on a plant-based diet, which is being vegan. That's where I'm at right now.
Absolutely. I mean, I've heard of lots of people doing the IV supplements through naturopaths. Um, Personally, I haven't really seen the evidence to back it up on the need for it. Certain people, like if you have a obviously we are all unique with our own physiology and how well we absorb certain nutrients. So some of us absorb nutrients better than others. So there are a certain group of people who they don't absorb iron as well as others, or vitamin D or B12, whatever it might be. So in those unique cases, and that is, you're usually again followed by a physician and or a dietitian. That is when I've seen evidence actually supporting it, that like IV infusions of vitamin B12 or iron in those unique circumstances. But and I always try to tread lightly, because I don't want to ever throw, what you're doing under the bus or throw other professions under the bus. But it's just important to like, there are instances where excessive nutrients has been shown to be harmful. Obviously, as with anything, the dose makes the poison. Some vitamins and minerals can be toxic at high levels. So it's just important to make sure that whatever you're getting through your IV is not in levels that would exceed toxicity for certain, especially your like fat soluble vitamins like A, D, E, and K, and other ones too. So that's something I just would want to look at, and we can discuss, of course, another time if you want, if it's possible to get a list of the vitamins that are given to you through, or minerals, in the banana bag, what you get through your IV infusion, just to make sure you're not getting excessive amounts of certain things, because excessive amounts have also been shown to have adverse reactions, again, with either treatment or medications, or just with cancer patients in general. So you just want to make sure you're not exceeding any of those, like vitamin C for one. High doses have been shown to actually have a negative effect. Especially in supplement form. So yeah, I'd be happy to discuss that further with you, just to make sure you're not exceeding any of those. What was the second question? Sorry, the IV infusions and the vegan diet.
Yeah, the plant-based diet.
So obviously there is a lot of solid evidence on the health benefits of a plant-based diet. There is just, as humans, we don't necessarily absorb certain plant-based nutrients as efficiently as we do from animals. So for example, iron being one of them, heme iron is what we get through animal sources, and that's very bioavailable. We tend to absorb that really efficiently, versus non-heme iron comes from plant-based sources. Not saying that you can't get it, you just need to make sure that you're getting enough. So you need a lot more plant-based sources of iron in your diet daily to ensure that you're meeting your iron needs and having the ability to absorb the iron. And omega-3 is another example. So as humans, we need EPA and DHA, which comes from the fish sources, and ALA is what comes from plant sources, and we have to convert the EPA and DHA to ALA, and our bodies aren't very efficient at doing that. So again, we just need to get more of the plant-based omega-3s, such as your flax and walnuts and hemp hearts and things like that daily, to make sure you're getting enough. And then other things too, making sure you're getting enough protein. But absolutely, there are numerous benefits to having a plant-based eating pattern. I know methionine is another topic that's in the early stages of research right now, discussing a methionine restriction when it comes to starving cancer. But again, it's still in early stages. They haven't really done enough research on humans to make broad statements, but a more plant-based diet, lower in animal meat, would give you lower methionine. So that would kind of encompass that as well. So again, you really just want to make sure you're meeting your nutrient needs daily for protein, omega-3, calcium, vitamin D, those types of things. And then if you are, then the vegan diet can be very beneficial.
Thank you.
You're welcome.
Question. Thanks, Rob. There's a couple of good questions in the chat. I just want to bring one to your attention. So in the context of a patient having chemo with rising ALT and ALP on the blood work, do you have any recommendations to improve those blood work levels with diet? And then we'll go to you next, Erin. I saw your hand there.
That would really need to be person specific. So I'd rather that question come to me afterwards and then know a little bit more about the person's situation. Just because there could be obviously other factors affecting the blood work as well. But absolutely, you can send me that one after, and I'd be happy to communicate that and search into it more, just because it's hard to apply that in a broad or general sense.
Okay, all right. So I will follow up with you on that, Eric. Okay, Erin.
I'm happy to follow up separately too if this is too precise, but I recently had an ileostomy, and I'm just at the point where I'm reintroducing like more regular foods into my diet. And one thing I'm having trouble with is like different sources, like good trustworthy sources, like the handouts from the dietitian and from the hospital. Some of them have conflicting stuff, like can I have tomato seeds and tomato skins, or can I not? Like some say avoid nuts totally. Other ones say, you can have a handful of nuts. And I'm just feel like I'm a little lost, and like there's so much information that I'm feeling overwhelmed by it, and I don't know which one to follow or what to follow. And I didn't know if you have any tips on that, or if there's some foods that are like absolute no-goes, or if you can kind of try anything and sort of in small doses and see how it goes. And then the follow-up question I had was some of these things mentioned maybe taking a B12, like getting a B12 shot, depending on how I guess I'm wondering about that. Should I be asking my doctor about a B12 shot?
Absolutely. So yeah, I kind of can address that in a broad / general sense, and I'm more than happy to discuss with you further afterwards as well. But I totally get that. I hear that a lot, that there's conflicting information, and it's like research has evolved over the years too, with what types of foods can be tolerated after certain surgeries, or after having a stoma. So that's kind of where the conflicting because I know what you're talking about, like the resources and handouts that you kind of get afterwards. What I will say is that 4 to 6 weeks post-surgery is your most critical period, right? Where the gut is still healing, everything's still kind of healing. After that, so that 4 to 6 weeks is where you want to follow that more low residue diet, just because it's easier for your body to digest, and it's easier. It doesn't leave a lot of like remnants for bacteria to feed off of, which can cause uncomfortable symptoms. And also after that 4 to 6 week period, most people like your nutrient absorption also comes up too, right? So anytime somebody has like a resection or a ileostomy or colostomy, anything like that, they wonder about if they can absorb certain nutrients. So again, it really depends on the person, but after that 4 to 6 week period, your body adapts quite well, and you're usually still able to absorb nutrients just as well as you would before, sometimes even better, because it kind of addresses some issues that might have been there before. However, again, it's really person specific. Again, like sometimes like you might have somebody with an ileostomy that is really not efficient at absorbing B12, and then somebody that they do adapt and they absorb it really well. So blood work would be really important in this situation, right? Just monitoring your B12 levels and making sure that you're not low, and trying to make sure you're getting adequate B12 through foods. And then over time, say if still 6 months or a year and your B12 is still low, that's when you might want to talk about implementing some type of either high dose supplement or an IV infusion. And again, just going back to the low residue, just because I hear it a lot. So really that 4 to 6 weeks is where you want to avoid most of those foods. And then you can start slowly reintroducing a lot of those foods back. But again, usually it's person specific. So some people might be able to tolerate lactose after an ileostomy or any type of surgery such as that, and some people might not. So after the, let's say 6 weeks, you can slowly start to go back to your normal regular eating patterns. And then that kind of a food and symptom journal is important at that point, because then you can kind of pinpoint what your specific food triggers are.
Thanks very much.
Thank you. Kim?
Thank you. Couple of questions. I had a lower anterior resection about 5 years ago, and it's been very tough to tolerate any fiber. I'm just wondering if you got any tips or tricks. Can manage some root vegetables, but when I'm trying to eat, it's just crazy. I need to eat healthy, and I can't seem to get healthy food. And the other part is they took out my gallbladder with liver resection, and does that modify things as well? Thank you.
Well, absolutely. I hear that a lot, that some people can tolerate fiber better than others. And then we're always constantly hearing, increase your fiber, increase your fiber. Fiber is really important. And, if it's been years and you're still finding that you're not able to tolerate certain things, I mean, sometimes little small changes can help with the digestion, such as just making, like, some people can tolerate really well cooked and softer veggies versus, having them more tough or firm or uncooked. Something like so simple, but digestion starts in the mouth. So we have enzymes in our saliva that start the process of breaking down food, right? So sometimes, like, even just chewing your food more, like just really taking the time, chewing a lot more, can help start that digestion process and make it easier once it gets to your digestive tract. And then smaller meals. So trying to have smaller meals throughout the day is a little bit easier to digest than others. And then obviously, yes, absolutely. If you still have specific, from what I've seen personally with clients, is that it's not necessarily all fiber foods, but more so like specific types of foods. So it's like, then it becomes like trial and error, different types of higher fiber foods like oats or quinoa, or some people can do lentils but not black beans, or vice versa, right? So just really trying small portions. Sometimes it really is the portion size. Like, some people can tolerate a quarter cup versus half a cup, and playing around with those different portion sizes, starting out with maybe a couple tablespoons and just seeing how your body reacts, just so that, because like you said, it really is important to try to see what you're able to tolerate from these foods that have so many benefits. And then over time, hopefully, and again, I'm more than happy to work with you one-on-one if you want to reach out to me after, and we can kind of work together over time to figure out what your specific triggers might be. Because a lot of the times it's just a handful of triggers versus all fiber foods. And then with the gallbladder, the other one, again, like normally within a short period of time after, you want to limit your fats, and especially like, deep fried foods and saturated fats and things like that. But normally after the surgery, again, like, it really depends on the person. Sometimes it's 2 months, sometimes it's 6 months, sometimes it takes up to a year after surgery for somebody's digestive tract to go back to kind of quote unquote normal. But you should be able to introduce, again, small amounts, and especially like healthy fats such as that you can tolerate, such as avocado or olive oil or nuts or seeds, again, given that you can tolerate those. But other than that, there shouldn't be any, most people can tolerate fat just fine, again, unless it's that kind of critical 2-month period right after the surgery. You're welcome.
Thanks, Felicia. Another question in the chat here. I've heard protein shakes can be harmful if you're taking too much. Is there any limit to how much protein we should have in a day?
This one is tricky. So, but I can kind of answer it generally, but there is a certain population of people that would want to monitor their protein intake. So if you have any type of like kidney issues, like acute kidney injury or chronic kidney disease, that population would need to kind of monitor their protein intake. And there's some other select cases too, but for the average person, it's actually really difficult to eat excessive amounts of protein, right? Like most people on average, again, I've done tons and tons of nutrition assessments and just monitoring clients and patients' food intake. Most people get about 20% of their daily calories from protein. So this would probably vary again, depending on if it's female or male and how much you're eating, but anywhere from 60, and sometimes people get less and really find it hard to even get that 20%. So I'm more so usually working with people on how to increase their protein, especially if you have any other ongoing issues such as, you know, loss of appetite or nausea or muscle wasting or things like that. But it's very rare that I find somebody can get to that kind of like even up to 30% of your intake is completely fine. I think so 60, I meant to say, so 60 grams to around like, let's say 120 grams to 130 grams. Again, depending on if it's somebody who's a male or active or taller, then they need more calories daily. So then that 20% of their calories is going to be higher. So they're going to naturally need / get more protein. But other than that, like, again, like you really have to start seeing like 35 to 40% of your daily intake, which is like 150 grams, 200 grams consistently, which is really difficult to do, even with protein shakes. So, and protein shakes, you know, protein powder, whatever you want to call it, you know, whether it's pre-mixed beverages such as, you know, onshore or just protein powder itself that you're mixing with milk. Those have been around for decades and have been heavily researched. And a lot of the time, again, same as what I said with carbohydrates, when we're digesting carbohydrates down into their basic form, it's glucose. And with protein powders, we're digesting it down to their basic form, it's amino acids. And I know, you know, wellness culture will talk about additives and things like that. But, you know, most additives in our food system is safe. And they've been heavily studied. Again, protein powders and drinks have been around for decades. So yeah, I that's my kind of all, you know, trying to broad generalize it, but saying that there's no issues and it's really difficult to get too much protein.
Okay, thank you. And Liz, did you have a comment on that or a separate question?
My question was around, I know there are all different types of protein that you can purchase. Is there any one in particular that we should be avoiding, or does it matter?
Really,
because I was just curious about the soy protein in particular, I think.
I get where you're going with that.
Yeah.
So that's actually another common myth that I hear is about soy having an impact on either increasing cancer risk or being harmful for cancer patients. And it's one of those things, again, that kind of certain studies may be done in mice or in vitro studies, things like that might show some type of links or association. But when you look at the overall broad evidence of soy, especially when it comes to soy in food, it is shown as safe and actually beneficial. There is, you don't see those same benefits with protein powder that is from soy, because whatever way that they isolate the soy, you don't get that soy isoflavones, which is a compound that you get from the food. Now, soy milk and tofu and edamame beans, like those all have the benefits that you want from soy products. From a protein powder, soy is probably one of the ones that I actually wouldn't recommend getting your protein powder from. Like I would either do, obviously if you have no issues with whey, either preference wise or tolerance wise, whey protein and whey protein isolate has been shown to have benefits, but there's lots of really good vegan protein sources out there as well. It's just, you want to see a vegan protein source that comes from multiple different plant-based proteins, just so you get that complete amino acid profile. Soy is actually one of the only plant-based proteins that does have a complete amino acid profile. So I definitely recommend getting soy through food. It's one of the, again, like, because of the process of isolating the soy, I wouldn't recommend soy protein powder, but that's probably the only one that I wouldn't recommend.
Okay. All right. Can I add one more piece? And I think I'd asked you this question before around kombucha, and you gave me some feedback, and I don't know if anyone else has asked the question. So I just was wondering if you could share your thoughts on it with everyone.
Absolutely. So obviously, we know about the emerging research of probiotics and the importance of having probiotics in the diet. And just from a gut health perspective, and then there's other associations with health as well. And kombucha is one source of probiotics. It's a fermented food, but any fermented food such as kimchi, sauerkraut, yogurt, will have probiotics. So the general recommendation is to get probiotics through the diet. Now, I have seen some recent evidence. I can't quite remember off the top of my head, but I'll send it to Cassandra if I can find it, specifically about kombucha, because of how concentrated it can be, and the specific types of strains, probiotic strains that can be in kombucha. I would recommend discussing it with your physician and healthcare provider, just because it can impact certain treatments and medications. But that's really the only thing. For the average person, for the general person, we obviously want to get more probiotics in the diet from a gut health perspective, and probiotics have been shown to be beneficial for cancer prevention, cancer treatment, and kombucha is one way to get probiotics. But I would definitely just check into that with your physician, just to make sure there's not any implications or adverse reactions with medications or anything like that.
Okay, thank you.
You're welcome.
All right. Well, with that, thank you so much, Felicia, for providing this presentation and taking these questions this evening. And thank you to everybody here on the call for joining us tonight. I hope that you found it informative and valuable. Thanks, Rob. Wonderful, wonderful. And if you do, get things going, if you think of any questions after this and you say, oh, I really should have asked Felicia, please just send me an email, and I'd be happy to connect you and pass along the question and have it answered for you. And with that, I wish everyone a wonderful evening.
Yes, thank you so much, everyone, for your time, and take care.
Thank you. Bye now.
Thank you. Bye. Just realized there was a direct message there. Oh, it was just somebody saying thank you.
Mine doesn't want to close. Doesn't want to close. I can't stop.
Like Cassandra and Felicia. Yeah, I'm the one to ask the question about the ALT and if there was any diet can help improve. So, and so can we just talk a little bit about it at the moment, or
I do have to head out now, but I'm more than happy to meet one-on-one, Eric, and discuss further with you 100%.
Sure.
Cassandra can connect us, and I can send you my assessment form just to get a little bit of background information, and then we can work one-on-one together to discuss that further. Absolutely.
Okay, sounds great.